Understanding mental health. Mental health is affected by lives, even that leave a profound impact on one's personality and behavior. Such events could be domestic violence, child abuse, or long-term high stress. If mental health is impaired, mental illness may result. Mental disorder can change how a person deals with stress, relate to others, make change, and trigger a desire to hurt himself. Among the most common types of mental disorder are depression, bipolar disorder, anxiety, post-traumatic stress disorder, PTSD, obsessive-compulsive OCD, and psychosis. Some illnesses occur only in certain types, such as the postpartum depression only affects mother after childbirth. Symptoms of mental health. Mental illness or mental illness may begin with some of the following symptoms, including screaming or fighting with family and friends, delusions, paranoia, or hallucination, losing the ability to concentrate, fear, anxiety, or overwhelming guilt, inability to cope with stress or everyday problems, excessive anger and violent tendencies, have bad experience and memories that cannot be forgotten, have a mind to hurt yourself or someone else, withdraw from people and everyday activities, hearing voice or believing things that aren't true. In unexplained pain, experiencing a drastic change in mood that cause problem in relationship with others, confused, forgetful, angry, offended, anxious, annoyed, worried, and initial scared, feeling sad, insignificant, powerless, hopeless, or without hope, smoking, drinking alcohol or more than normal, or even using drugs, drastic change in eating habit, such too much or too little, sexual arousal change, significant fatigue, energy loss, or sleep problems, being unable to perform daily activity such as child care or going to school or work, unable to understand the situation and the people of mental health. Some common cases of mental disorder, among others, head injury, genetic factor or a history of mental disorder in the family, domestic or other abuse, child abuse, or a history of childhood violence, has a chemical compound disorder of the brain or a brain disorder, suffer discrimination and a stigma, experiencing the loss or death of someone very close. Social loss such as poverty or debt, caring for a chronically ill family member or friends, unemployment or helplessness, the effect or toxin, alcohol or drugs that can hurt the brain, severe stress experienced over time, sociality isolate or lonely, live in a bad neighborhood, significant trauma such as military fighting, serious accidents, or crime and the like. Diagnosis: case mental. Psychiatrists and psychiatrists begin to diagnose a mental disorder by beginning a full medical and psychiatric interview with a complete history of symptoms and family history of illness. Then followed and through a skull examination to eliminate the possibility of another disease. If needed, a doctor will request support examination such as steroid function, alcohol and drugs screening, and CT scan to identify brain disorder. If there is a possibility of another disease being eliminated, doctor will provide medication and therapeutic plan to help manage the patient's emotion. Mental health care. Psychotherapy. Psychotherapy is a speech therapy that gives safe media for people to express their feelings and seek advice. Psychiatrists will provide assistance by guiding the patients with feelings control. Psychotherapy, along with drug talking treatment, is the most effective way to treat mental illness. Some examples of psychotherapy including cognitive behavioral therapy, exposure therapy, dialectical behavior, and so on.